Hi, my name is Sophia Tripoli. I'm the Director of Healthcare Innovation at Families USA. Today, Consumers First, the alliance that brings together diverse organizations representing the interests of children and families, working people, employers, and primary care to improve the fundamental economic incentives and design of our healthcare delivery and payment system, is releasing its 2021 Congressional Legislative Agenda. The 117th United States Congress presents an important opportunity to address inefficiencies, inequities, and market failures in the U.S. healthcare system that drive high cost and low quality care for our nation's families. Each of these underlying problems was compounded by the COVID-19 pandemic. The COVID-19 pandemic sent shockwaves throughout the country, resulting in hundreds of thousands of deaths and millions of people falling ill. It further unveiled the harsh realities of existing disparities in health and healthcare in the United States, where Black, Latino, and Indigenous communities experience significantly higher rates of infection and death. And it triggered the worst economic crisis since the Great Depression, with millions of people losing their jobs in health insurance. All told, the pandemic created enormous new challenges for our healthcare system and exacerbated long-standing problems that threaten the security of our health, the financial sustainability of certain sectors in the healthcare system, and the economic livelihood of our nation's families, workers, and employers. But long before the pandemic struck, the US healthcare system was already in serious trouble. Prior to COVID-19, national expenditures on healthcare were rising at a staggering rate. In 2019, the US spent $3.8 trillion on healthcare, which is more than we spend as a nation on any other public benefit program. Yet for all that spending, our healthcare system produces some of the worst health outcomes, including the highest rates of maternal deaths and infant deaths compared to the other industrialized countries. And healthcare costs have been rising faster than workers' wages, making it more difficult for families to access and afford healthcare. We simply cannot afford to continue at this rate. To address the US healthcare cost and quality crisis, and to safeguard our healthcare system from future public health crisis, Consumers First urges Congress to consider key policy reforms that will drive value into the United States healthcare system in 2021 and beyond. These policy reforms fall into 5 key areas. 1, driving down healthcare costs for consumers, working people, and employers by addressing consolidated healthcare markets. 2, lowering prescription drug costs for our nation's families. 3, improving price and quality transparency in the healthcare system. 4, establishing national data sharing and interoperability standards to reduce waste and improve healthcare quality. And 5, developing and implementing a national health workforce strategy. Whether the 117th Congress is divided or not, the Consumers First 2021 legislative agenda offers durable policy solutions that will improve health and ensure the healthcare is affordable for our nation's families. To read the Consumers First agenda, please go to familiesusa.org, click on the Resources tab, and then search for Consumers First 2021 Legislative Agenda.